When recovering from an injury or a medical condition, there is no better place to do so than the comfort of your own home. Here to tell us what Home Rehab Express can do for you or for a loved one is Marcos Poros, the owner of Home Rehab Express, and Dr. Mark Farmer with Orthopedic Center of Florida. Great to have you both on. Good morning. Today we're going to talk about, well, first of all, tell us, Marcos, a little bit about Home Rehab Express. There really is no better place for rehab services than your own home, right?
Yes, we are a home health company that basically goes out surgical to help you rehabilitate yourself at home.
And dealing with what kind of different treatments? We've talked knee before. Today we're going to talk a little bit about shoulders.
Yes. If you're ever wondering how it's like to recover from a surgical shoulder, simply not use your arm for a total of about 4 days, and you'll find out real quick how difficult it is just to get in and out of a couch.
Oh my goodness. So what kind of problems do you see, Dr. Farmer, when it comes to shoulders? What are people dealing with?
A lot of the time patients come and see us and say their shoulder hurts, or their arm hurts usually, because it's sometimes you have to differentiate, or always you have to differentiate. Is this really the shoulder, or is it sometimes coming from the neck? So the shoulders, they come in and, you know, we have to differentiate. Is this an arthritic problem? Is this a rotator cuff problem? Is this a calcium deposit problem within the shoulder? And the typical things we do, again, we talk to the patients, we ask them, you know, what makes it worse, what makes it better, if they got any weakness associated with it. And then we'll get an x-ray, and we want to take a look and see whether they have any big bone spurs. Do they have arthritis in their shoulder? Are the joint spaces narrowed and things like that? The typical treatment usually, again, for a rotator cuff problem, unless it's a tear, is non-surgical. Injections and therapy becomes real important to help.
It's always kind of best, if you can, as you say, to treat it without surgery if it's possible.
If we can. And a lot of rotator cuff problems can be. Unfortunately, if you have a tear, then we know that in time those tears will get bigger. And it's much easier to fix a small tear than it is a large tear. The good news is that it can be done arthroscopically. I mean, we can do this through 3 or 4 little holes in and around the shoulder, remove the bone spurs, and then reattach the rotator cuff back to where it is supposed to be. Afterwards, there's a lot of therapy involved, and the thing that everybody always complains about is that the amount of time it takes to get better, and that's a lot of therapy. Sometimes we do it at home after the surgery. Sometimes we do it as an outpatient setting, but it's a long process to recover from it. But when we started doing this arthroscopically many years ago at this point, we find that we have a lot less calls requesting pain medicine. There's a lot less pain, and I think the recovery is also a little bit quicker. We used to do them all open, and now we can do them arthroscopically, which certainly helps.
And Marcos, speak to that therapy a little bit, because if someone's going through this and they're experiencing pain and they've been in to see maybe Dr. Farmer, this is kind of where you can come in with Home Rehab Express.
Right. Yes. After surgery, basically, we're set up on a protocol where the patient has a sling on, and they are educated and advised not to be removing this until the therapist gets out there and or the nurse. 9 times out of 10, it's got to be repositioned, because they come home and they squirm a lot in it and try to fix it, as it happens.
Trying to get comfortable, as I can understand. How important is that therapy to follow up with and keep along? We've just got a couple seconds left, but I know that
it's very important, just because scar tissue can develop by leaving the arm in one position, and so that's where the therapist comes in to make sure that the patient maintains a good range of motion.
If you want more information, check out their website, a really good resource to learn more about the company, homerehabexpress.com. So certainly check that website out, and then you can also check out more on our website. Thank you both so much for being here. We look forward to having you back.
Thank you very much.
Go to